No matter how careful we are, sometimes accidents happen. No matter where we're going, we get nicked and poked and scraped and cut along the way. And no matter what, our integumentary system, including our skin, does its best to keep us and all the important things inside us from harm. One of the primary purposes of skin is protection, providing a sturdy wall of 4 or 5 layers of skin, separating the outside world from the tissues and organs underneath. Though skin can't stop you from doing stupid stuff, it can clean up most of your messes. When we get cut through the avascular epidermis to the dermis beneath, blood is drawn, which triggers an immune response from our mast cells in the region to bring more blood, macrophages, and phagocytes there to help engulf germs. Next, thanks to platelets in the blood, scabbing occurs. This mass of clotted blood and proteins helps to seal the body off temporarily before it's replaced by other tissue. Next, epithelial cells from the stratum basal will divide and migrate to help scoop underneath the scab, sealing the body off and redefining the barrier of the skin. When the scab comes off, this tissue here will be available to replace the tissue lost at the surface. Finally, fibroblasts and capillaries from areolar tissue deep to the dermis produces granulation tissue, which is mostly collagen and other fibers. This tissue will eventually modulate into scar tissue if the cut is serious enough. Eventually, the scab and its deeper portions will dissolve along with the capillaries. What results when the scab is removed is a section of the dermis with abnormally high amounts of collagen and low amounts of blood vessels. Cells destroyed in this area are eventually replaced with collagen too. This tough, fibrous junk, which is called scar tissue, may fade over time as the epidermal cells continue to divide and shed. This process might take 2 years. However, extremely deep or severe cuts or injuries may be so packed with collagen and fibers that it is impossible to restore normal blood flow and skin integrity to the area. In this case, it will remain a scar forever. Accessory structures such as hairs, glands, and receptors including touch typically won't be restored to a scarred area as there is no place for them to anchor down in all the collagen and no nerves or capillaries to which to be connected. There are some surgical procedures available to remove large amounts of scar tissue, however, and there are some lotion products that claim to soften scar tissue to help restore skin to a more natural look. However, this procedure can never be total, and some scar tissue will always remain. Though scarring may look unappealing, it's actually a sign of the amazing way your integument works to keep you healthy. Scarring won't cause any problems or pose any health risks, and it actually prevents further damage by restoring the protective layer around your body. When it comes to scarring, stem cells, fibroblasts, and capillaries all cooperate to repair damaged skin and maintain that precious balance of homeostasis. You are carrying precious cargo after all, and your skin is your first line of defense. Scarring is just a way of adapting to changes, another day in the life for your incredible integument. So the next time life throws a cut or a scrape your way, you might wince a little and slap on a band-aid, but don't forget to thank your super skin for doing all it can to keep you in one piece. Your integument may give you the evolutionarily perfect cellular guard dogs, the optimal climate-controlled environment, and the keys to unlock that big H homeostasis, but it definitely can't give you common sense. So please, try to be a little more careful the next time around. But no matter what, your skin will always have your back, and the rest of your body too.